Hello and welcome to Community Connections. I'm your host, Kevin Bargender, and I'm joined here today by Jess Boyles of the Family Center. Hi, Jess, and welcome.
Thank you for having me.
You're welcome. Can you tell me about yourself and how you got started in this field?
Sure. So my name is Jess, like you said, and I work at the Family Center. I am the Sexual Assault Services Coordinator over there. I was born in Rapids. I'm from Rapids. I actually went to school in Toronto, Canada, though, for social work. And I've been at the Family Center for about 4 years now. And how I got started in this field, I guess, from a very young age, I always knew that I wanted to work with people. I love people, and always really liked the mission that the Family Center had, and always just wanted to work with survivors of domestic and sexual violence.
So why did you choose going to school in Toronto versus staying in the United States for college?
I had just gone to Toronto and I really fell in love with the city, so that's when school came up. It was just a good opportunity, so that's pretty much why.
Did you enjoy your time there?
Yeah, I loved it. Mm-hmm.
And then what was your degree that you got from there?
Social work.
Okay.
Yeah.
And so you said you've been doing this for 4 years?
At the Family Center for 4 years.
Okay, and then any experience before then?
So I interned at a women's shelter in Toronto, and also interned at a nonprofit for English language learners. It was basically a writer's workshop, and I've also worked in nursing homes and that sort of thing.
So can you explain to me what a victim advocate does?
Yeah, definitely. So this is a big question. I like to say that kind of whatever a survivor of domestic or sexual violence needs, the people at the Family Center can usually answer those questions or help them navigate the system or find someone that can help them. Like I said, we do work with survivors of domestic violence, stalking, sexual assault, but my area that I specifically work in is sexual violence. So some of the things that I do, I accompany survivors when they go to the hospital for a sexual assault forensic exam, which means basically collecting evidence off of the body, which is used for court record or trials in the court, for police reports, that sort of thing. I also do a lot of peer counseling. I facilitate a support group for survivors. We can assist victims with restraining orders, court accompaniment. We also have a visitation program at the Family Center so that children can do safe exchanges with their parents when there is abuse involved. And like I said, just overall advocacy, whatever a survivor might need, we try to hook them up with that.
So you have a pretty big role with the Family Center. I mean, you're kind of doing a lot of work. So how exactly, or what would you say that the Family Center does for the community?
Yeah, so another big question. Nobody really walks through life thinking that I might be the victim of a crime. But unfortunately, it happens to a lot of people. And when you are the victim of a crime, that's a really hard system to navigate. A lot of people don't know what the court process looks like. It can be intimidating to go to law enforcement or to just go through these different systems that survivors need to navigate. So we really help the community understand what that looks like, and then help those specific survivors with whatever they might need regarding that. We also do a lot of prevention and outreach work within the community. So we work within the schools, different organizations, spreading awareness about domestic and sexual violence, hoping to eventually stop it. But that's a cause that might not happen in the immediate future, but we try.
And you're located right in Wisconsin Rapids, correct?
We are.
All right. And so what would you say is the most rewarding part of your job, or why you really kind of chose this line of work?
Yeah. So obviously with domestic and sexual violence, a lot more people than the average person knows experience this. So a lot of people just think that it happens to a couple of people, and they don't really realize that it's so widespread. Children, adults, people of any gender, any race, any financial background. It happens to so many people. And there's also such a stigma and shame attached to being a survivor of that sort of violence. So I would say the most rewarding part is really just reminding people that they're not alone in that, and being able to empower people and show them that there's people out there that get it and want to help. That's very rewarding for me.
It's a pretty heavy topic and heavy subject, and a really involving job. How do you kind of separate your personal life from your work life, since I'm sure you do kind of get invested a little bit in your clients?
Yeah, and that's a question I get asked a lot, actually, because it is a really heavy topic, like you said, and people kind of shy away from it, especially when they hear what I actually do. But for me, it's kind of the same thing that I would tell my clients, is taking care of yourself, doing a lot of self-care. For me, I love to go on road trips and go hiking. I have Chihuahuas at home, so I love to hang out with my dogs. That's kind of my self-care. And of course, boundaries are really important, that we want to help people, but we also want to have people help themselves too. And I'm also very lucky to have a job that I just really, really love, and I meet very incredible, strong people. So that really helps out when you have a job that you really love. So,
kind of speaking about like somebody that might be on the fence that's looking for help, if they were kind of hesitant or not really sure, what would you normally tell them?
And there are so many people, like I said, there's so many people that this happened to them and they're not sure if it was sexual violence or domestic violence, but they know that something doesn't feel right about it. And like I said, there's so much shame attached to it. So there are a lot of people in the community that don't come forward and don't seek services. But to those people, I would say that at the Family Center, we really are a staff that is non-judgmental. We really try to connect with people right where they are, and we're never going to force them into anything or tell them what they have to do. We are really there just to walk with the survivors through some of the really hardest times in their life. But the biggest message is that if you're on the fence, just know that there's people who will absolutely not judge you and are there for you 100%.
What activities or organizations are you involved with, or the Family Center is involved with in the community?
So we have a lot of collaborations throughout the entire community, because obviously we try to help people specifically with issues related to survivorhood, but there's so many needs that a survivor might be facing, whether that's financial difficulties or needing a ride to appointments, people who have substance use concerns or mental health concerns. So we refer those people to multiple different organizations. We work very closely with Wood County Human Services for all of their different support services for individuals. Also, Love Inc., Inclusa, just to name a few. We work closely with the Wood County Jail. We do offer services to survivors who are incarcerated. We have a support group within the jail also. So just so many different organizations that we partner with to try and do wraparound services for survivors.
How exactly do you kind of get the word out or kind of spread the message of the Family Center? Do you go on radio shows or do you advertise? What exactly do you do to kind of let people in the community know that the Family Center exists in this community?
Right. So things like this, we really appreciate you having me on, because this is a great way to get the word out. We do a lot of radio interviews. We have a monthly radio interview actually with WFHR in Wisconsin Rapids. We also we try to get in the schools a lot and in different community organizations to do presentations about what we do, and also prevention work. So talking to different people about how to prevent childhood sexual abuse, preventing sexual assault, what healthy relationships look like. I guess that's another thing that I should mention with how involved we are in the community is that we're always looking for people who are interested in learning more about the Family Center, because we really depend on outreach to get the word out. So if you want to directly help survivors of domestic and sexual violence, that's a great way to do that, is asking us to come speak at your church or your organization, or even just you as an individual. If you want to learn more, just give us a call and we're happy to talk through those things.
And there's a board with the Family Center.
Mm-hmm.
How exactly does the board kind of work with the employees of the Family Center?
So we do have a board. I'm not super involved with the board. That's more of our executive director's role, Sue Sipple. But they are the people who, they also help get the message out about the Family Center, and they oversee our policies and procedures and that sort of thing.
In working with Wood County, I'm assuming it's much more of a challenge when someone is incarcerated.
Mm-hmm.
What kind of different challenges do you face when someone's incarcerated versus someone that can really come to the Family Center and be in person, versus you having to kind of do like an out call and go to them?
Yeah, and that's a good point, that it is more difficult for some people to access our services, especially people who are incarcerated. So we do actually go within the jail, and a lot of the people who are residing at the jail have those extra boundaries. Obviously, being involved in the criminal justice system is a huge boundary. But we do collaborate with the jail and try to get in there for support groups and meetings to provide those services exactly in the same way that we would someone who's able to actually just come to the Family Center.
What do you think you kind of learned in your 4 years from like when you first started at the Family Center to, I guess, current day? Like, what would you say that is like something you have more knowledge about now than you really did when you started?
So I guess I knew this going in about just how many people really are affected by this type of violence. But since working at the Family Center, that knowledge has just been like tenfold of how many people do experience that. A lot of people feel like Wood County is a very rural, safe community, and it is safe for the most part. But I've just learned that there are just so many people who have experienced this, whether it's childhood sexual abuse or as adult. It's just a very widespread epidemic, unfortunately, but thankfully there's people that are trying to stop it. So.
And do you work closely with like the sheriff's department or the police department for the city?
We do work closely with them. We have some pretty strong partnerships with them. Not everyone who experiences violence reports it, but for those who do report it to police, we are available to sit in with those police interviews and of course go to court with them. So it works both ways. When somebody presents at the sheriff's department or the police department, they will often call us for assistance, and when somebody comes to us wanting to report to law enforcement, we will contact them. So it's a really good partnership.
And if someone wanted to like learn more about the Family Center or get in contact with the Family Center, how would they do that?
So there's a couple different ways. We do have a 24-hour crisis line that is staffed night and day. People can call at any time, and a live person will always answer, and they'll be there to talk to you. That number is 715-421-1511. And people interested in just learning more can also call that number, or they can contact us through our website, which is familycenter.org. They can also email us at info@familycenter.org.
Awesome. Is there anything else that we haven't covered yet that you kind of would like to talk about, or something that you would like to highlight?
Just again, that the Family Center does things for the community, but we are a nonprofit, obviously, so we also really depend on the community for what we do. And I think that there's a lot of people, obviously everybody is against domestic and sexual violence, But there's a lot of people who really do want to be involved, and they want to not see people suffer and see people go through this. And there's a very tangible way that they can do that, whether it's through presentations or getting more education from us, donations. I should mention that too. We have a food pantry. We have all sorts of household items so that when a survivor of domestic violence gets their own housing, we can, set them up with laundry soap and toilet paper and all of those things. So donations is something that we accept. We also really depend on our volunteers for different things at the Family Center. So if you want to help out and directly serve survivors, that's a great way to do it, is getting involved with us.
So you can, I kind of just thought of this too. So you're helping kind of people from ground zero sometimes, from when they're kind of, maybe they're not established at all. They have to start from nothing. How hard is that?
Yeah, that's pretty difficult. And I'm not sure if I mentioned this or not too, but we do actually have a safe shelter at the Family Center for families or individuals, people of any gender, any age, can stay there if they're in imminent danger of violence. So a lot of these people are fleeing with just what they have on. They don't have any of their documents, they don't have clothes, toothpaste, nothing. And we can assist them with finding housing too. So the moment that they come there with basically nothing on them, we're there to support them, but also help with those tangible things like housing, clothing, furniture, all those sorts of things.
How have you handled kind of going, and I'm assuming you probably knew this, kind of going in your field, but going out in the community, doing presentations, letting people know, how have you handled that, do you think?
So, for the most part, people are very, very receptive to what we do. And like I said, so many people want to help out and they want to learn because nobody wants to see people suffering, like I said. So that's actually a really great part of our job, is that we're not always doing the direct services that can really wear down your heart, I guess. We can also go out there and do the prevention work, which is a little bit more inspiring, for lack of better words, that we're trying to actually stop it where it starts. So.
And how often do you do food drives? Like, do you do food drives like monthly, weekly, or or also is there like something for school supplies for people? What kind of drives do you have, and how often do you have them?
So actually, a lot of our donation drives happen from our community partners. So we have had churches, restaurants, bars, different organizations do drives for us. So there's not a set time that we do it. We just partner with different organizations that are looking to help us out. And if anyone is interested in holding a drive or donating, I would encourage them to get a hold of us through our website. Our volunteer coordinator, her name is Deb Cleworth. And we also have a community relations coordinator, Amy Scheid, who people can get in contact with if they're looking to do fundraising and that sort of thing.
And do you have any social media or anything that people can kind of follow you?
We do. We are on Facebook and Twitter, so people can look us up on there as well.
Awesome. Well, if you don't have anything else, I'd like to thank you for stopping by today and taking your time out of your day to come do this. It was really great. And I'd like to thank our viewers for watching. I'm your host, Kevin Bargender, and I'll see you next time on Community Connections.